I had so many unanswered questions.
There really wasn't anybody my age that I could talk to.
The peer mentor program has been uplifting is the best way I can describe it.
Their face lights up when you suggest connecting them to a mentor.
I had the opportunity to become a peer mentor after suffering isolation and depression from a different healthcare system that did not offer peer mentorship.
When I was diagnosed with kidney failure and I was on dialysis, my cousin donated one of her kidneys to me. There wasn't really any peer mentors our age.
One of the biggest challenges in all of medicine is the uncertainty that the patients face. Our peer mentors give them a perspective on what the journey is going to be like. They lend an ear, they answer questions in ways that us as healthcare providers don't do.
Being able to talk to somebody who has been through that experience and is doing well after therapy and back to their normal life is extremely helpful.
A peer mentor can, give them tips and tricks and different tools that they've used. They can say, I know what you're going through. I've sat in that chair before. Let me help you out.
They really helped me with seeing there's so much out there that I can do more than I can't do. And I like to give that back to others.
I work with a lot of younger patients, and they are very fragile at that moment when they're finding out that they're in organ failure of some kind. I think all it takes is a little conversation with them and letting them know that you've been there and they can relate back to you.
There is a lot of data to suggest that the more support a patient has from family, friends, or peer mentors, it impacts positively their quality of life and even their cancer outcomes.
By having the peer mentors involved, the individual patient does benefit, but I also think the program staff and the entire program benefits immensely.
I wasn't sure if I would have enough time and resources to work on it, but it is by far my favorite thing that I do.